Good evening, and welcome to the first episode of the Daily Dose podcast with myself, Dr. Suhayl Essa. The point of this podcast is to highlight the importance of evidence based medicine in a very uncertain time. As you guys all know, we've got a global pandemic, the COVID 19, which I'll be discussing various aspects of every single day. To help me, I've done some research on website that most medical students above third year would probably know. It's called PubMed, where I find a lot of evidence-based medical journals to back up my opinions on what's going on currently in South Africa and the world in this pandemic. So the first episode is entitled, Is Cyril Doing the Right Thing? Cyril Ramaphosa is the president of South Africa, and he has just announced that there'll be a national shutdown for the next 21 days.
When I addressed the nation last Sunday, there were over 160,000 confirmed COVID-19 cases worldwide. Today, there are over 340,000 confirmed cases across the world. The National Coronavirus Command Council has decided to enforce a nationwide lockdown for 21 days with effect from midnight on Thursday, the 26th of March.
Well, he didn't just announce it a few days ago. He gave us time to prepare. So, the first question that a lot of people have been asking me on Instagram and just in my day-to-day life is, why are we locking down? Is this the right thing to do? An answer to that question is yes, definitely. Is definitely the right thing to do. We needed this lockdown, and I'll discuss the various aspects of the lockdown and having a nationwide shutdown at this time. Is it the right time? We'll also talk about that. So first, let's start off with the history of the disease. Specifically in South Africa, we got our first case of confirmed COVID-19 disease on the 5th of March. Now, this came from a guy who was traveling from Italy. I don't know why he was there. Came back to South Africa, confirmed in KZN. They quarantined him, sent him home. After a few days, he just had mild symptoms. At that point, nobody was taking this thing seriously. People were out at Ushaka, in nightclubs, dancing and singing, Corona, Corona. People were making house tracks. It was a party. So people didn't take it seriously, and that's generally what's happened around the world. But then on the 15th of March, we surpassed the 200 mark. So that was in 10 days. In 10 days, we went from one case to just over 250 cases, which then triggered the president to come out and make a statement where he implemented some restrictions. Now, at this time, he just implemented some basic restrictions, things we should have already known and been doing since day one. Hand washing, social distancing, greeting with the elbow, all those things. Those are things that we should have been doing from the beginning. But I think he needed to solidify that into the South African public's mind. Then specifically, he also banned large gatherings, so of 100 people or more. Now, I don't know where they got this number of 100. I'm going to be honest, I don't know. There's no science behind it. I've looked long and hard for any journal that supports 100 people ban as a gathering to stop the spread of any disease. I feel like they were sitting in the boardroom. Some minister said, how are we going to curb the spread of COVID-19? And someone just said, ban gatherings of 100? Sounds good. Now, banning gatherings is obviously a good thing. And we've seen in other countries, which I'll discuss later, social distancing and banning gatherings has really helped them curb the spread of the disease. But in South Africa, the banning of 100 people, I don't think it really worked. But I know why, or I have an idea of why Cyril chose to come out specifically on the 15th of March when we had 250 cases. There is a reason. Because he could have come out on day one. Surely he could have come out on day one and just said, hey guys, we're shutting down the country. Corona's here, guys. Let's lock down our borders. Let's shut down everything. But no, he waited until the 15th of March. Then he announced, no, we're shutting down the borders. We're not allowing people to come into our country from high-risk countries. And then we are also going to quarantine people that have already arrived in this country from high-risk countries for 14 days. Which is great. But the reason why he specifically chose to put in those restrictions by the 15th of March is if you look at the graph, and I'm sure a lot of you have heard the term flattening the curve. There's a specific graph that people use. It's the number of time versus patience on this graph. So if you look at the graph, at the point where we were on the 15th of March, as we went from 1 to 250, that point is known as the inflection point. So where we are at currently versus where we are at the beginning, if you look at the graph was sitting at 250, which was our inflection point. The inflection point is the point where it would have started exponentially increasing, which it has done. But he chose to come and put in those restrictions, the social distancing, all of that, at a time where if he did not, it would have gone even more exponentially higher. But then people obviously would be wondering, why didn't he just do it on day one? Surely that would have stopped everything. Now, you also, as any policymaker, you've got to look at it from all aspects. Firstly, the economic consequences of putting in a restriction from day one. If you put in this type of a lockdown from day one, people are going to suffer, people are going to starve, jobs will be lost. And apart from that, you lose your population's trust. Because generally, a population does not understand all of these big medical terms, what the disease entails, what ramification it has on the healthcare system, none of that. So you're going to have a population that goes, what the hell, Cyril? We have one case. Why are you shutting down the country, bro? We still all right, man. Don't treat us like idiots. So my thinking is Cyril sat back and went, look, my people are not going to trust me if I shut this country down now. They don't actually fully understand. But let's do this. Now that we have one case, the media is going to start pumping stories. They're going to be telling the layman in the street about corona. They're going to try and educate the layman in the street how to prevent it from spreading. And then once the public actually understands what's going on, and they know what's happening in Italy and China and all over the world, then we'll shut down the country and then they will understand. So I think that's why he did it on that date. And then on the 23rd of March, we had just over 400 cases in our country. And that's when Cyril announced, yo, we need to lock this country down in 3 days. He even gave us a few days to prepare, to pack up, to boil our dal, to fry samosas, make our pickles, all the things that we needed to do in time for the lockdown. He gave us that grace period. But why now? Why on the 23rd of March? Why did he wait another week? I think that it's a very difficult task, and you have to get buy-in from an entire country, and not just the population, but business, from the business sector to the healthcare sector, everyone to be in agreement of this lockdown. So there's probably a lot of negotiations happening, thoughts on either side. But I think the president understood that if he did not lock down the country completely at that point, we are going to see people dropping. And so I think he made a very good call. And in the lockdown restrictions, there's some very pertinent restrictions that he has put in place that I must commend him for. So the one thing that he did do, which a lot of people found strange or weird in the initial restrictions, was that he banned gatherings of more than 50 people in restaurants, pubs, taverns, you name it. and he prohibited the sale of alcohol after 6 p.m. Now, a lot of people go like, but how is that going to help? Alcohol, people just having a good time. That's exactly the point. You see, in South Africa, as a healthcare professional, we know that when people drink, they have too much of a good time. In fact, when I was working at Charlotte Macleke Johannesburg Academic Hospital in Joburg, which is one of the biggest trauma centers in the country and world renowned, the majority, I would say 80 to 85%, in fact, a study was done when I was an intern, 80 to 85% of our trauma in our unit, and I would assume the same for every trauma unit in this country. The majority of our trauma is all related to, yes, you guessed it, alcohol. People will have car accidents because they were drunk driving. People get stabbed by criminals because they're vulnerable, because they're drunk and they don't know what's going on. So people get stabbed, robbed. We have a crime problem in this country. And that's exacerbated by drunk people around walking in the streets. Then the other thing we used to see a lot, domestic violence, but as a result of alcohol. I mean, I could go on forever. I pretty much seen it all. We'd have friends coming in after having had a few drinks at home, and the one guy made a joke about his t-shirt and he shot him. Like, that's a reality of South Africa. We have a drinking problem. And so forbidding people to drink after 6 also is a message to them to go home. Do it in your house, it's fine. Drink with your friends and your family at home. And don't be out in the streets. Because I'm sure a lot of you also know that alcohol is a social lubricant. People feel more free to touch each other. They're less cautious than they normally would be. Like people that normally wash their hands 100 times a day. Now when they get drunk, they're not. They're touching their face, rubbing other people's faces, maybe even get promiscuous. Now you can't get promiscuous. You're at home with your family. No one's promiscuous. So all of those things are reasons for forbidding alcohol now in this current lockdown and forbidding it after 6 in the previous restrictions. This definitely takes a huge burden off the healthcare sector. My friends that work at Baragwana, Joburg Gen, they all have said this is the best time to work in any emergency unit. The day they stopped selling alcohol after 6 was a dream. Like traditionally, us as doctors, when it comes to month end, when people get paid or people get money, the first thing they do is buy alcohol and want to celebrate. So we knew, don't take the month end shift. Never take the month end shift. The month end shift is the shift that will end your life, because you know you're going to get lots of drunk people inappropriately touching you, fighting with you, swearing at you, having been assaulted. It's just a terrible time to be in the hospital. But now, when there's no alcohol freely flowing, people are behaving themselves. So that's a great thing. And then the other restriction that the president's put in now is the restriction of tobacco sales. So tobacco and all tobacco products now during the lockdown is put on hold. Now, I don't have any actual evidence, but I have anecdotal evidence from friends of mine that own garages, other friends of mine that own supermarkets that have had to remove the tobacco products off their shelves. And the messages that they're getting from their head office is the reason why we need to stop selling tobacco is to basically make our country healthier. Especially in a time when you're dealing with a respiratory virus that affects your lungs and everything else. Smokers tend to be more susceptible to pulmonary infections. And so we don't want to have that coupled with the COVID-19 issue. So now, the respiratory wards, I mean, the thinking behind it might be that the respiratory wards might be a little more empty if we ban tobacco sales. Now, it's not to say that people can't get their hands on tobacco. They will find a way. And you're going to have a lot of people that are going to go into withdrawal and have issues. But it'll be much more difficult for them to get it. As I'm sure you're all aware, anything in this country right now that people want, the prices have been hiked. Whether it's masks, hand sanitizers, even cigarettes. If you're going to buy now illegal cigarettes, they're going to be expensive. And that's a good thing, because you don't want the average South African man to be able to get his hands on a pack of cigarettes at this time, or alcohol for that matter. So I think very good on the president. Well done on that. So that's what we've done thus far. Those are the lockdowns and the restrictions that we've put in place. And I think it's a very interesting time for us as South Africans. Now we look at our government and I'm shocked. I don't know about you guys, but I'm shocked. I'm surprised, because I never thought that our government was this resourceful. In a matter of weeks, they've come together, showed us that they actually have leadership potential and skills. I'm proud, I must say. And here's an interesting story that I recently read when I was researching a whole lot of these things. So, Lindiwe Sisulu, the Minister of Human Settlements, has found 29 areas in South Africa, which are townships or informal settlements, that are heavily populated. And her plan is, she's now decided that she is going to find areas to depopulate them. So she's found 29 alternate pieces of land that she can relocate these people to. So she's relocating people from townships into other areas where there's land. Now, I don't know about you guys, but when I hear the ANC is finding land, that means they're working. They must be worrying. They must be panicking. There's no way the ANC is going to be under pressure to find land unless they really have to. So that's something I'm proud of. Well done, ANC. You found the land. On top of that, Lindiwe Sisulu has also sent out 1,000 water tankers to the Eastern Cape. And these water tankers are supposed to relieve areas that don't have adequate hygiene, sanitation, so they're worried that people aren't going to be able to wash their hands or keep clean or hygienic during this time. On top of that, I think that it's very strange. It's very, very strange that it takes a virus for us to realize that poor people need running water. Very strange. But on the plus side, I am glad that the government is actually doing something about it. Now, let's look at what the rest of the world has done and how we can probably learn from them. So, other countries, and let's look at the leaderboard, because I know a lot of people, let's be honest, because we don't have sports, we look at the numbers the same way we do it as the Premier League log. So today, the USA is leading in the world for number of confirmed cases. They are now at 82,404 cases. China is sitting at 81,782 cases. And Italy is at 80,589 cases. So those are today's stats. Now, what do I think about this? So, firstly, let's talk briefly about China. China, particularly in the Hubei province, where the virus initially was found, is actually starting to lift a lot of their restrictions. People are starting to go out. Restaurants are starting to open. You can order food and they'll deliver it to you. They have successfully flattened the curve. But remember, the difference between South Africa and China is that China is a communist country. So naturally, people abide by their laws much more easily. From a young age in school, they're taught that the government is everything. If you don't listen to us, you are not part of China. They're very rooted in their country, and these are their values. And if you're not part of us, then you are against us. And so communism definitely has a role to play, because their lockdown restrictions were viciously implemented. Viciously. People were beaten, thrown in jail, forcibly put in quarantine, even if they didn't have symptoms. If your next door neighbor just said, "Hey, I think I heard a cough next door," army is there knocking on your door. Oh, expect Toba, and it's them, and they're there and they're locking you up. And so those heavy restrictions on the Chinese society has successfully flattened their curve. They're not seeing a sharp rise in their cases every single day. It's successfully flattened, but at the cost of civil liberty, which in a democratic country is very difficult. Then you've got a country like Italy and USA, and of course, I'm sure you guys have heard in the news, a lot of people criticize them for acting too late. I agree with this. I think that USA could have acted much quicker, but of course, they have Donald Trump as a leader who has no idea what is going on in the country. Absolutely no clue. This guy will jump from topic to topic, talk about treatments when he knows nothing about any medical treatment. This man has no knowledge of. He's talking about them being done with the whole pandemic after Easter weekend, which is not even like a week or two from now. It's ridiculous. So, I mean, USA, they're pretty much screwed. They've got the highest number of cases now. And look, they're doing the best they can under the circumstances, but I think they acted too late. Then you've got Italy, who also acted very, very late. And I think that the role of them acting too late is definitely the government's fault. I think they had mixed messages coming from the government. There were prime ministers tweeting, "No, guys, it's fine." People sitting with ministers sitting with a group of friends on a Sunday afternoon, having a glass of wine, saying, "Don't worry, don't panic." Whereas, in the center of the outbreak, at the epicenter of their outbreak in Lombardy near Milan, cases were growing rapidly day by day. Then, as I'm sure you may have heard, they had a lockdown on the 9th of March, or they announced that there was going to be a lockdown on the 9th of March. So people immediately in their thousands flocked and moved all the way from Lombardia, spread to the rest of the country, taking it from what is a big city or metropolitan city now to all the rural areas in Italy, which don't have ICU beds, don't have ventilators, can't take care of really sick patients. So that was their big flaw. And I hope that hasn't happened to us. My fear is that a lot of people may have migrated and already left and gone back. If you look at pictures at Park Station, at all the bus stops, people were moving and migrating back home now when they announced our lockdown. And I hope that doesn't have a negative effect on the number of cases that we see now. And then lastly, and very importantly, I want to talk about India. So, because it's my homeland. India had their first case on Jan 30th. And they are currently only in day 3 of their 21-day lockdown. So from 30th of Jan until now, nothing. Absolutely nothing. They haven't had any restrictions. Up until 3 days ago, they had no restrictions. They had nothing to stop their movement. They had no social distancing. And this is in a country with 1 billion people, or just over 1 billion people. I don't know how they're doing their business at the moment. I don't know. What I'm saying is they were very lax about this. And it's weird because they only have just over 600 cases confirmed in the country. And when I was doing my research, I found, and the source is Business Insider, which I'll verify that source, but I think that it's attributed to the number of tests that they've been doing. So, like us in South Africa, we've successfully completed over 20,000 tests, and there's a huge backlog currently. And testing, which I'll discuss on Sunday's episode, is very important in containing major outbreaks, so you can track numbers. It helps with contact tracing, all of those types of things. And in our country, we've done over 20,000 tests. We've been trying as best as we can to test as many people as we can, but there are certain limitations. India, and if you look at their figures, India is said to have been doing 10.5 tests per million people, as opposed to another country, which I haven't spoken about, South Korea, who did 6,000 tests per million. Now, 6,000 tests means you can find exactly where these people are, where they're spreading, trace who they've come into contact with, and successfully eliminate the virus from rapidly spreading, which they have done. Because South Korea has flattened their curve at, I think, around 15,000 cases. And the reason for this is because they were very disciplined. They've had previous outbreaks before, like they've had the MERS, which is Middle Eastern Respiratory Syndrome. They had an outbreak, I think it was in 2012. They had 38 deaths, and they learned from that. So now they too, similarly to China, put in very, very stringent social distancing measures to make sure that this virus doesn't spread fast. And like they even have cameras in the street, like they watch your every move. And they were tracing people. Like if you went to a shop and you had it, and you came into contact with the teller, and then you walked outside and you greeted someone else, they literally have cameras throughout the entire country that could trace people's movements. They even had apps. They have apps on people's phones to trace your location, to trace it's really insane what like how much of people's civil liberty they removed. But at the end of the day, they flattened their curve, and they're not seeing any new cases, like consistently new cases. No more deaths. A lot of their restrictions have been lifted. They're now walking, moving freely. All good times. All good times. And I just think to close, I just have a suggestion for our country in this lockdown, because a lot of people have asked me, how effective will this lockdown be? And I think I'm going to have to do an entire other episode on that, because it's a lot to talk about. But I think this lockdown is necessary. However, my initial thoughts are, what are the police and the army's capabilities in this whole situation? Like, what really can they do? An average army soldier and police officer earns between 10,000 and, at their highest ranking, 23,000 rand a month. So you're telling me the army doesn't take cool drink or what? They will. And that's why it's up to every single one of us as South Africans to abide by these rules that have been put in place to protect us, our families, and the greater good of South African society. A lot of us are very comfortable with bribing police officers and, whatever other officials. Now is not that time. Put your cool drinks away and abide by the law. It's our own personal social responsibility to do this, because I don't think that they are equipped enough to police us like we are babies. We are not babies. We need to abide by these rules. I also don't think that I've been involved in 2015. I was involved in Fees Must Fall. I don't think our police are good at crowd control at all. Like I'd be standing there, we'd all be singing a song. Next thing, big cop comes on there on the speaker. If you don't disperse in the next 15 minutes, we will open fire. We're still looking around going, what is the move now, people? What is the move? 5 seconds later, bah, 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 rubber bullets are flying, shooting directly at people, tear gas. It's just, I don't think that they're effective at crowd control. It's been a while since apartheid. I don't think they know what they are doing. So it's up to us as South Africans to take our own full social responsibility on this. And going forward, I have a suggestion for what we could do in this time. So Cyril, if you're watching, I agree with you. You are doing the right thing, but this is what you can do. I've come up with a plan. Now, it may sound ridiculous, but hear me out. I think we should nationalize McDonald's. Okay? I know you think this is ridiculous. Why would you want to nationalize a restaurant that serves drunk youths at ridiculous hours? Well, I'll explain. Firstly, McDonald's is the biggest landowner in the world. They are, in essence, a real estate company. They own all the land in which their restaurants are on. So McDonald's has about 37,855 restaurants. 200 of those are in South Africa. That's a lot of land. The EFF talk about nationalizing the land and taking them back from the Ruperts and the Oppenheimers. You know who wants land from McDonald's? The Ruperts and the Oppenheimers. So let's ask McDonald's to chip in and help us out. We use their restaurants. And what we do is, you see, they came up with a great plan. Raymond Kroc, back in the 40s, when he stole the idea of McDonald's from some other brother we don't really care about now, he stole the idea of making a fast food restaurant which would follow conveyor belt design. So one person gets the bun, another person fries that bun, then fries the patty, another person adds a tomato, then a handful of stale lettuce, then 2 squirts of mayo, 1 squirt of the tomato because they're stingy, and then a pinch of disgusting, and then you have your burger. In that same way, we utilize their fast food system to better the lives of South Africans, because Lord knows they've destroyed a lot of people's health. So first, when people arrive at that drive-through, they give their symptoms. Someone on the other side, who is a healthcare worker or nurse or just a call center agent, responds. Do you have fever, cough, sore throat? Okay, have you traveled in the last 21 days? All the criteria that would allow you to have a test. Okay? Then they drive to the next window, pay, get a questionnaire. Who have you been in contact with? What have you been up to for the last 14 days? Blah, 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 blah. Fill out that form. Then go to the last window, and nobody has to get out. It's safe. The nurse puts on a full PPE, protective gear, on the whole body. Everything is covered except for her eyebrows, which she's drawn on way too high. She comes out, swabs the nose and the mouth, puts it back in, sends it off to the lab. McDonald's saves South Africa. So that's my suggestion, and I hope you guys have enjoyed. I'm going to quickly look at all the questions that you guys have said, and then maybe I'll answer a few now. If I haven't answered your question today, I'll answer your question tomorrow on the podcast, because remember, this is the daily dose. So let's have a look at some of the questions. Cool. Let me have a look here.
Just one.
All right. Yeah, sis. Yo, people are asking me for other advice. Okay. Also, I don't do consults on the podcast. If you guys want medical advice, you guys need to go to a hospital, see a doctor. You're welcome. Well, don't come to my house. I'll come to you if you want. But like, I can't answer questions on that. I need to take a full history and everything else. So, speaking of the media, do you think there are things they are not sharing with us? Very good question from Tinyiko. I'll answer this question. It's very important. So today, we had over 1,170 cases, 13 recoveries, and surprisingly, on the first day of the lockdown, 2 deaths, which I find very interesting. Is this a political move? It might be. I don't think it's possible for us as a country to have 1,000 infected people, and on the day the lockdown is implemented, 2 people die. Now, all sources that I've read about these 2 cases, one of the woman was 28, the other was 48. One was from a private hospital, one was from a public. Interesting. Weird coincidence that both of them come from 2 different spheres of life. One has medical aid, one doesn't. Weird. And then one of the patients was in ICU and she died. The other patient was also in ICU and she also died. But the one patient has all the symptoms but hasn't tested positive. Now, normally, in my line of work, I've declared people dead and you need to fill out that certificate. And if you're unsure of the diagnosis, normally you wouldn't say automatically it's a rare respiratory disease. You'd say viral pneumonia of unknown origin on the death certificate, which I find weird. Now, I'm not sure, but this is just a thought that I'm going to leave you with. Perhaps the government needed us to realize that this is serious. And they didn't want us to panic before, so they're only telling us about the deaths now. Because in my opinion, the same way India is having 600 cases with like no deaths, or like one death, or I don't even know what the current. In the same way, it's a political move not to, instill fear into the hearts of their people. I think before they might not have wanted to show people that this is really serious, in case they may have panicked. So it's a possibility that these 2 deaths being released now may have happened last night, or yesterday, or any other time. I'm not sure. I just think it's very strange, and it's a weird coincidence that on the first day of the lockdown, now we're telling people, oh, yeah, this thing can kill you. I think that's weird. I'll check for one more question, and then I'll see if it's relevant to... They say 3 weeks, but how long is the lockdown really going to last? Sandile Mzinyane. Well, I'm actually going to have to do another episode on the lockdown. And I'll talk, my feelings on the lockdown is it's going to go way longer. I want you all to know this lockdown is going way longer than 3 weeks. You heard it here first. I predicted that this lockdown was going to happen 2 weeks ago. I could have told you that this lockdown was going to happen based on the information I was getting from the NICD lectures, from my friends in government and in other sectors. I knew this lockdown was going to happen. And I'm telling you that this lockdown is going to be more than 3 weeks. And it's really vital, really, really vital that at this time in South Africa, we take this seriously. This week will actually determine how long the lockdown is going to be. Some people just making comments. Gosh, imagine it being longer than 21 days. Day 1 felt like 10 days. It really is. It's not an easy thing. And we're also going to talk about, in the future, we're going to do a podcast episode based on mental health and talking about how to cope during this time, because a lot of people get depressed being indoors. Is there a possible cure for the virus? We're going to do treatment on Sunday. Sunday, I'm going to be talking about treatment and testing, or maybe just testing on Sunday and then treatment on Monday. But we'll talk about treatment because I have done a bit of research and I can tell you guys about the treatment. I think that's all the questions that were relevant for the episode. Thank you guys for tuning in. I really appreciate it. You can catch this episode of The Daily Dose on all streaming platforms. That's Apple, Spotify, SoundCloud, you name it, as well as YouTube. So please like, share, subscribe, and tune in every night at 9 p.m. We might change depending on your guys' schedule, but we'll see. Hope you guys enjoyed. That was The Daily Dose with Suhayl Essa, episode 1. Is Cyril doing the right thing? I think so. So stay safe, keep washing your hands, and I'll meet you guys here again tomorrow for another episode. Assalamu alaikum. Good night. Peace.